Time now for this week's Health Matters. Paul Critz with you, along with physician assistant Lynn Szabo. And today we're talking preventative measures, correct?
Yeah, pre-exposure prophylaxis for HIV.
As the siren goes by, this is we're doing a little sound design here. There it goes. All right.
That's because this is urgent.
Exactly. That's exactly right.
Come on, Paul.
Okay, I'm sorry. Please continue.
So pre-exposure prophylaxis is also called PrEP, okay? It's different from post-exposure prophylaxis, and it's related specifically to HIV.
Okay, so post-exposure. Okay, all right. So post-exposure is after you've been exposed, but nothing has happened yet, and so that's when you can jump into it.
Right.
And that's like when if you're a healthcare provider, again, going back to my years of watching ER, and you get a needle stick.
A needle stick, yeah. So this is pre-exposure prophylaxis. So this could be under the category of risk management. So decreasing risk for people that are choosing, maybe knowingly, to kind of be involved in really high-risk behaviors.
Okay.
So,
that begs the question, are they still high-risk behaviors if they involve prophylaxis?
It depends on how good you are at it.
Oh, yeah. Okay, all right, good.
So this is medicine that is taken to avoid getting HIV from high-risk behavior. And you know what? It decreases the risk of getting HIV from unprotected intercourse 99%.
Whoa.
That's even for high-risk activities.
Whoa.
I know. So it also decreases risk of getting HIV from intravenous drug use by 74%. So less effective for drug use, way surprisingly effective for a decreasing risk of HIV.
Okay, wow, I'll be damned.
But they still recommend condom use with sex, which is kind of interesting to me because if somebody's deciding not to use condoms and they're getting PrEP in order to prevent getting HIV, I don't think anybody would think that would also not be preventative.
It's kind of
said that backwards.
Yeah.
That would not be preventative.
Also.
for getting other STDs like hepatitis C, hepatitis B, and syphilis. But the cool thing is this can be done with pills or shots. So there is actually a long-term shot. I think it's once every 3 months.
Really?
That
Wow.
somebody can get.
Huh.
But again, only prevents HIV, doesn't prevent all the other usual suspects that hang out. So
yeah, no, I see what you're saying. I'm having a hard time imagining the scenario in which all of this would. So you don't want to get HIV,
right?
So you get this shot or the pills, whatever, but you're still going to use a condom.
They're still recommending condom use, but I don't think I think people forget that part. So the next step is probably kind of lost.
All right.
Well, people want what they want when they want it,
I guess.
Yeah. So who should take it? Well, somebody who has a sex partner with HIV, especially if they're attempting to get pregnant.
Yeah. That's a very specific scenario, but yeah.
Yeah, it kind of blew my mind when I first realized this, but is totally possible to have an HIV negative child and born to a mother who has HIV or a father that has HIV and has a good long-term prognosis. So it's not a death sentence. It's not a crazy thing to do anymore.
Right.
Yeah.
Wow, I'll be damned.
So
I mean, I don't think people have really realized. I mean, maybe people have realized. It was surprising to me when I learned just how far along just like antiviral meds have come and how I mean, I remember AIDS and that's it, you're gone. You'll be out, you'll be checking out in a year or so. Right. And that's so not the case anymore.
No. I mean, totally not the case anymore. And then our next realization was, well, we can manage this with like 27 different pills a day and like you have to take them at the exact time, are really persnickety. And that's also kind of dropped off the radar. Everything has been simplified. And I think it's fair to compare a chronic, this HIV infection with something like hypertension.
What, as being just a condition that you manage?
Yeah.
Yeah.
That you're not really expected to die from necessarily.
And this just decimated, the gay population. Horrible. I misspoke. People misuse decimated all the time. That's just a common usage of
It
decimated.
was way more than decimated.
Exactly, because you know what decimated means.
Yeah.
But anyway, this horrible thing blows through, and just we as a society. I want to try to remember, like with the hole in the ozone layer in the 70s and acid rain in the Northeast, the times when we've actually managed to do things like right. Maybe not right in like with the AIDS epidemic, but more like this is a success story. We've like not beaten AIDS, but I think it's just so different. I mean, just people living, which was a death sentence 30 years ago, and now people can live for decades with this. And
it's a scientific
yeah,
success.
Exactly.
I think we have to point that out.
Right.
Yeah, and it wasn't overnight, Like I know it's known that I took care of some of the first people, like the first 12 people on AZT.
Wow.
And so I took care of a lot of people before that. And it pretty much was a death sentence. It was pretty horrible. But now it's pretty routine.
Yeah.
Yeah.
And you're right that we need to point out that it was science that did this, and it was people and scientists being able to keep their eyes on something longer than the 15 minutes of popular discourse and see it through.
And see how things were modified over time. I mean, there was a certain amount of trial and error, I guess, but it was super educated trial.
Right,
So,
exactly. So I just wanted to take a moment and point that out. Please,
Yeah.
go on.
Yeah, I would also point out that people also get AIDS, especially, maybe more relevant to this community in the IV drug using population. So,
And is that, in the U.S., is that how most people get AIDS?
I think it's still sex, but I think it's heterosexual sex.
No, yeah, like it is with the rest of the world, right?
I think the person at highest risk is a young woman of reproductive age.
Oh, my God. Okay.
Oh, my God, that sounds like teen clinic.
Mm-hmm.
Yeah.
Why was this? Are you being ironic? Or was this like just
I am a little bit. I'm also, I'm also, that's a sought after group of people that other people want to have sex with. So pretty common, and I don't think people would think about that.
Yeah.
I think that they have something else in their head about it. Anyway, so who else should take it? So anybody that's been diagnosed with an STD in the past 6 months, which is a lot of you out there, a lot.
Like any STD?
Any STD. So HPV, human papillomavirus, chlamydia, gonorrhea, syphilis, Hep C, Hep B. Those are all STDs. Okay.
I'm going to drop a pop quiz
and
on you.
They they travel together. Yeah, I feel like a name drop.
Yeah, exactly. So why that? Why is that? Why other? Is it just because it's indicative of behaviors or what?
No, I think it's just indicative that sex is a really good way to spread disease. And so there's a lot of organisms that have evolutionarily developed to use it as a mechanism to find new hosts.
Okay.
That's evolution.
Yeah, I know. But again, it's just not...
Nobody wants to think about it.
No. People should think about it because there's a lot of things that you're saying in the messaging here that logically doesn't make sense.
Right.
Why? What does that got to do with other STDs? When basically the explanation that you have is that no, anybody who's sexually active. Okay, so why are we saying, oh, if you've had other STDs, we're just taking that as being indicative of a behavior that you're sexually active, right?
Right.
Okay, that's what I want to understand. Yeah. Okay.
So also people who should get it is a person who is using injection drugs and their partner that they're sharing paraphernalia with has HIV. So this is weird to me. Like, why would you do that?
Share a needle?
Yeah, why would you share needles with somebody who's known to you have HIV? I don't know. But it also begs the question of why share needles if the person maybe doesn't disclose they have HIV. I think there's a lot of kind of risk there, huge risk. So it's okay to take this medication if somebody's pregnant or nursing, which is good. And it's okay for adolescents who have a lot of risky behaviors as long as they weigh at least 77 pounds. And there's just probably a milligram per kilogram dosing thing. And especially for adolescents getting the injection, I think the injection is every 3 months. So it's a weird kind of disease preventing, like Depo, like, you know, young woman, Depo Provera is an injectable contraceptive that's really popular with the teens in this community. And, you know, we could set it up maybe that they get PrEP at the same time.
How often do you have to get Depo?
I think it's every 3 months, 12 weeks, 12 to 14 weeks. So I think that might be an interesting, I wonder if some teen clinics are doing that. Anyway, it is super expensive. This is the problem. I've been asked to prescribe this twice working up here and 0 times working in Humboldt County, which is interesting considering the population that I oftentimes work with.
Why? Why is that interesting?
Because they're sexually active and they're coming specifically for birth control, or they're specifically coming for, you know, like treatment of Hep C or diagnosis of Hep B.
Yeah. Okay. So why? What's
that means they're at risk.
Sure. The separation though between Del Norte and Humboldt. Why is that a thing? Why is it different?
You know, I think Humboldt has other resources and other places that people could get that.
Okay.
That are probably known to them but fly a little bit under the radar. And up here, there really isn't any resource. Right. So it makes sense to go see the, you know, acute care provider at the walk-in clinic on Saturday.
What's the insurance scene with this?
It is covered, but copays are big and expensive, especially for injectable forms. So super expensive also because up here it involves clinic visits and labs. There's a certain amount of lab work that you have to get done. So there's a significant amount of money even if you have insurance. But there's a couple of places where you can get it for free or reduced, or you can get help. So
is this what's Ready Set Prep? What's that?
Yeah, Ready Set Prep. That's an organization. You can Google it. I got that information from the CDC. Go ahead and Google it. It looks to me like it's a place where you can get information about how to get it paid for, if not outright grant money. Depends on your income, of course, and your insurance status. And I don't even know how to pronounce the next one. Viv Connect.
Is it 2 I's? Is that what it is? VIIV? Okay.
I think that's the name of the injectable.
Okay.
So Viv Connect for the injectable. You know, you can go ahead and Google that, but I think you can get, if it's not outright paid for, you can get help with getting it. And a lot of these, when I Googled them and went to the sites, they kind of encourage people to get on Medi-Cal if they're income eligible. So there's kind of an encouragement to get it through Medicaid if that's possible. And then some states have PrEP assistance programs like California. I don't think that says available in other places. So, but super easy to figure out how to get help, super easy for the pharmacist to figure out how to get paid. And so the busy clinician in the clinic it wouldn't take very much time actually to get somebody set.
Okay, I need clarification on this then. Who's this for? I mean, really, with the messaging, I mean, who would be functionally, who would get the most out of something like this? And it's
in this county?
I guess in general, this just seems to be a...
I think teens. And I think people who use IV drugs, which this county has a lot of both.
Yeah, I suppose.
You know, we hand teens a bag of condoms and tell them to use it. So this is along the same lines, but more specific for the most quote unquote deadly.
Right. No, I guess the drug thing would seem to make sense. It seems like, you know, they're saying, oh, and also use condoms. Oh, and also it just seemed to follow along like it was some sort of like it would only be like applicable in like somebody who's trying to have a baby, somebody who's, you know, like it's not.
No, I don't think so. Here's what I see in my mind. So I see somebody who, let's say a young man, it's spring break. He's going down to Florida, going to hang out on the beach, has really optimistic hopes about meeting as many, let's say he's straight,
Really
cisgender.
optimistic hopes.
Let's say that he's,
Yeah.
he's hopeful in meeting a bunch of potential sexual contacts. That's the person I see that could be
Okay.
really helped by this.
Yeah, no, I could see that.
Or,
Sure.
it's not unknown for people to go to other countries to have sex vacations.
Oh God, yeah, that's true.
Yeah.
Yeah.
And, you might say, ew, but, those people deserve to be protected. And I think when you go on vacation, you're thinking about, okay, I'm going to cut loose and it's just going to be wild and free. And maybe it shouldn't be.
Yeah.
You
Yeah.
know.
Huh.
Maybe
Okay.
there's consequence for that.
I suppose, and maybe I'm being lulled too just by the fact that as we were talking about HIV isn't such a the death sentence it was, and so it seems
I
like
know,
we're going.
but we're both parents. We don't want our kids to get it.
No, that's true.
Yeah.
That's true. But I mean,
There.
it's just also I don't know.
I think we have to start being more aware of our personal risk.
Yeah. Yeah.
Yeah.
Okay. All right. It seems like such a specific kind of I don't know. Like it's redundant in a lot of ways. And I'm like, I'm glad we have this, but it doesn't seem like we really need this anymore. And that's kind of what, I mean, now that it seems like with management, and this is going to be so, blow me out of the water with this one, but with management, it's like HIV kind of becomes like herpes in a sense. In that it's not as horrible as you grew up thinking it was, and you can manage it by drugs, and it's a lot of people who exist
Right.
now with next to nil viral counts, for the rest of their lives.
What if you look at the monetary thing, though, for HIV? So think of how much it costs to keep somebody functional and healthy through their whole life if they have HIV. Now, wouldn't it make so insurance companies thinking like maybe it'd be better just to prevent it from happening than have to pay for it for their whole life?
Do you find that kind of thinking evident in a lot of insurance company scenarios? Are they actually thinking along those lines? Like it's more cost effective?
I'm also thinking they're thinking, how can they dump this patient? 'Cause
Right.
they're obviously got some high-risk behavior going on.
And yeah, exactly. And while there might be like money to be saved in preventative medicine and preventative measures taken like that, there's also a lot of money to be made from a chronic condition for an insurance company too. I mean, meaning that those are balanced,
Right.
sorts of things, past
Right.
a certain outlay, then, I
Right.
don't know. I don't pretend to.
And then I think you step into does preventative medicine, is it ever really worth it? The preventative medicine part of the Affordable Care Act's under attack right now.
Really?
Yeah.
For why?
In the judiciary. Because they want people to start paying for their screening colonoscopies and screening mammograms and screening lipids and screening STD testing. Yeah. So if you don't go in with a specific complaint, if you're just being responsible, they want you to pay for that.
Because they were trying. So that tells me that sector of healthcare is much bigger than they had anticipated, and they've realized they're losing money on it.
They're losing money.
Wow.
Yeah. So, yeah, that's unfortunate, and it looks like it's probably going to end up going to the Supreme Court.
Wow.
So is healthcare a right or a privilege?
It
Anyway.
is. Yeah, yeah. What's the question? Because it's very obviously a privilege in this country.
Right. So remember,
and I'm sorry, before you jump in, I want to do this. Do you have any? Can you give us a ballpark? I mean, how much does this drug cost, or these drugs? How much did these?
when I looked at it before, that was probably a year ago, a couple thousand.
couple thousand
for
for
a
what? A
course.
dose
For
or a course?
pills,
Okay.
For a course of
Okay.
therapy.
Wow.
And I remember that includes somebody had to pay to come see me. Somebody had to probably get a certain number of lab tests. So they want, like, is your kidney function good? Can you
Right.
take these drugs safely? Do you not already have HIV? So, that would require testing and stuff. So, yeah, that's kind of expensive.
That's expensive.
But how much is a life worth? I don't know.
Well,
How
I'm
much
sure
is-
there's somebody in the insurance industry that has a number that they could attach to a life. Wow. Okay.
Yeah.
I'm just curious. Just trying, ballparking.
Yeah, I tried to get it for somebody, and no pharmacy in town knew how to get it paid for, and so
Really? Here?
basically it never happened. Yeah,
Wow.
yeah.
Now, has that changed? I thought you said earlier that
About a year ago.
Okay, so then it's easier now. It's more covered. and
Well,
people-
now here's resources that apparently nobody in town's aware of.
Okay.
hence the topic today.
Thanks. All right. What are the resources?
Yeah. Well, we talked about them already. But
okay.
remember, there's also post-exposure prophylaxis. And this is another thing that this town doesn't do super well. Most of the providers, it's not that hard. It sounds scary. Nobody wants to make a mistake, I think. But let's say, you're at the playground with your kids and you get pricked by a used needle. Okay. And then, so what do you do to get care? Because starting care as soon as possible becomes really important with this. Well, you probably bounce to the ER. So that's a big expense, an ER visit. And then oftentimes, at least early on, the providers weren't really certain how to do it, and it was hard to get up-to-date information. But now we have a medical library called UpToDate, so that's available. But the best thing is to call the warm line at UCSF. So they have infectious disease fellows on call who are specifically trained in HIV. They're super approachable. So Joe average person can call, but also providers can call. They call you back. It's a warm line, not a hotline. So they call you back in 20 minutes or something.
Wow. Okay.
So it's super responsive. And they not only talk to you about what meds, and some meds are different for certain clinical conditions, but they also tell you, remember, you might want to make sure they don't get hepatitis B. And so what do you do for that? And you might want to test them for other things like Hep C, or, is their tetanus shot up to date? So really even mundane things. And I think it's just really easy to use, and they have everything covered. So I just document in my note that I've talked to them, and this is the result, and we're moving forward on it.
Wow.
Super easy.
That's yeah. Now, earlier you said we talked about the resources locally. Refresh my memory, because this whole time we're sitting here, I'm going, what resources are we talking about? You said the resources, and you said, yeah. I said, what are the resources? And you said, we talked about them.
The resources are, so the worm line's one. Okay. I'm sure they'd answer your questions about that. Ready, Set, Prep.
Okay, right.
It's a financial resource, probably also educational. CDC educational. The Viv Connect for the injectable, educational, and also these include monetary resources.
Okay, good. Gotcha.
So how do you get help with the copay? You got insurance, but the copay is like, are you kidding me?
Wow.
And how do you get that covered? And you probably have to pay for it up front, my guess is, and then you'd get reimbursed a certain amount, depending on how much you paid or what you ended up getting put on.
Just so much of our conversations just comes down to billing.
To money. Yeah.
Oh, God, man. Yeah. All right, you said you had a soapbox to get up on before we started recording today. What's your soapbox today?
There's another STD in town called syphilis, and it's kind of, syphilis used to be... up here used to be like maybe once in a career diagnosis.
Really?
Maybe a couple of times. It just wasn't around, or maybe people didn't look for it. Now it's definitely around. It's making itself known. It's a horrible disease. It's called the Great Imitator, which means that it's easy to mistake it for other diseases while it merely eats your brain.
Oh, my God.
Okay? So significant consequences of long-term untreated syphilis. We're starting to see it kind of in the OB population. I'm starting to see it in the homeless population.
What do you mean OB population? Expectant mothers?
Yeah.
Wow,
expectant mothers.
Okay.
And I'm starting to see it definitely in, the homeless population who don't have super resources or insight to deal with it much.
Or with anything, but yeah.
Right. So I think it's going to go for a big run in that population, kind of unnoticed.
Oh, wow.
And since it can affect so many systems in your body, but I think the most terrifying one is it can make people lose their minds, insanity, okay, or dementia, or blindness, or horrible skin things that are like, out of the books you used to look at, to gross, your mother would gross you out and say, you have to wear condoms.
Yeah.
So
I don't know what kind of house you grew up in.
Yeah.
But my folks left that to the public schools. So now is there a super syphilis yet? I know there's a super gonorrhea. There's a
no,
treatment
syphilis
resistant.
remains very.
It's like treatable, right?
Very treatable with penicillin. But what if your grandma told you had a penicillin allergy,
and you never, true.
Yeah, and you don't really know,
Yeah.
So, and then you get treated with maybe the second best or third best option, depending on what's going on.
What about diagnosis? If it's something that like you were saying up here, we haven't historically seen, and it imitates other things. I mean, it's possible, I guess, to be misdiagnosed for years, right?
It is, and people don't believe they have it. That's why That's why I'm on this soapbox right now.
Mm-hmm.
And so I say, look, this looks like what we're seeing in syphilis, and I think you ought to get tested. Oh no!
Oh, that's not.
No, that's not me.
Thanks, I'm flattered, but no.
Yeah, I know. So let's go through your behavior in the last 6 months or last year. Oh yeah, you're at risk.
Oh wow.
Oh
wow.
yeah, you're
Okay.
at risk. And sometimes it's kind of interesting to me that when people go in and I want to be tested for STDs, I want to be tested for everything.
Uh-huh.
And then as soon as you say, okay, this is what everything means, first of all, everything is everything that your funder will pay for.
Right,
Because nobody wants to put their own money into it because it's expensive. And so then it turns out that I just want to pee in the cup. I don't want to get blood drawn.
Well,
and
that's not everything.
That's not everything, number one. Number two, that's not syphilis.
Okay.
Syphilis is diagnosed with a blood test.
Okay.
And then it's kind of intricate to understand it after that. So you have to get a provider who's willing to put some time in understanding it. It's really kind of complex to find out what you have, and then how you get better from it after you've been treated. And it requires a number of visits, plus big old shots in the butt by Nurse Ratchet, and you can't go, oh, I don't want to get a shot in the butt, so I must not have syphilis, because it's out there and people are getting it, and please don't.
Well,
please.
good. I'm glad you clarified too, butt, because I thought the medical term for it was tuchus. Okay, good.
Poppies in Spanish. Gluteus maximus.
It's funny to me to think of, like, and we've talked about this before, just about the diseases, especially STDs, because there's an inherent funniness to that because of third grade humor. But that there's a map that, like, up here it's like, oh, this is chlamydia town over here, our region, and over here, like, syphilis hasn't really been a thing over, like, I just think it's humans. It's going to be everywhere, kind of spread evenly because of humans, but it's not. That there's regional proclivities and
sure, the South actually is a big center of syphilis.
Really?
I wonder how much of that syphilis is a descendant, microbial descendant of Tuskegee.
It's like heritage syphilis.
I know.
Oh, no.
Oh my God. So we don't have to have that kind of situation here. It's not that hard to get treated. It's really not that hard to get tested at all. And, I'd be glad to help you out on Saturday at walk-in clinic if you want me to, or if you're a teen clinic.
Are you looking at me when you say that? I don't have syphilis.
Paul's going with denial. Nobody has had zero risk.
That's
so
true.
The
There
way
you go.
that's phrased in the exam room, so I understand your risk is very low.
Oh, there you go. Good. That's
okay,
nice. Yeah.
but don't you think a peace of mind test would be a great thing to do right now? I can get that done in 7 minutes. Let's move forward on that.
Oh, wow.
Okay.
All right. Well, there you go. There's your next Saturday.
Yeah.
Yeah, well, so any inclination? I know we're trying to have this Suboxone talk. Are we going to try to line that up for? I can't do next week, or Lisa can't do next week. She's over in Medford every other weekend, so we'll have to come up with something else.
Yeah, I think we should have some kind of phone call discussion about how to do it too.
How to do what?
You
mean off air?
That
Gotcha.
implies that I'm trying to put words in people's mouths, which is not what I'm saying.
Oh, no.
But we could go with the usual free for all. But I think it would be that organizational part of me is going, this is the situation. Okay, go.
Okay.
At least start with some foundational information.
Okay, no, we can
on
talk.
it.
Okay, we can build into that. Then.
Yeah. So if not next week, the week after,
Okay,
perhaps.
perfect.
Okay.
All right.
All right.
That's it for this week's Health Matters with PA Lynn Szabo. I have been and will continue to be for at least the rest of the day, Paul Critz. And thanks for listening, everybody. And Lynn, we'll see you next week.
Mm-hmm.